Hello guys, myself Dr. Sudhir Kumar Shahi, Director, Department of Cardio Thoracic and Vascular Surgery, Kalra Hospital in Delhi. It is a very old hospital and well known for cardiothoracic surgery and cardiology, overall the cardiac sciences. And we are doing here the well. And my message regarding the cardiac diseases, cardiovascular diseases, and awareness about these in our type A and very, I can say, the stressful society until the causing factor for cardiovascular diseases. So all of us must have some modified lifestyles, dietary habits to be incorporated in our routine life so that we can be healthy from the cardiac point of view. And as you all know, this is the pump of the our body. So once your pumping is good, you keep pumping in the daily routine life with lots of energy. So my message to all of you that your dietary habit should be without any junk foods and fat laden foods, because bad food creates bad cholesterol in your body. So we must be aware about our diets. It should be high protein, adequate carbohydrate, and polyunsaturated fatty acids at least, and not the saturated and trans fats containing foods in our routine dietary habits. And beside that, we must have some physical activity in our life, because the physical activity burns your cholesterol, burns your fat, and it enables your endothelium, your blood vessels, to be free of any hard plaque or soft plaque, and it maintains its patency. So chances of stenosis gets minimized. And aerobic exercise are also called the cardiac exercises. So you, all of you must have in your routine activity the aerobic cardiac exercises, and it includes jogging, brisk walking, running, not very much fast, and all sort of just not heavy exercise. It comes in our aerobic exercise, and it just helps in the making healthy hearts in all of you. So this cardiac exercises, your dietary habits, two things are very important. And beside that, your addictions to smoking, your addictions to alcoholism, your addiction to just out home diets, all these things has to be minimized. Smoking itself is very important culprit for endothelial injury, and alcohol also not the less than smoking. So it makes you sedentary as well, and your dietary habits also get, I think, deviated from the normal which you supposed to take in your routine habits. So they directly or indirectly make your heart unhealthy. So keep yourself away from all these things. So no smoking, no alcohol, no out home parties, and routinely aerobic exercises, and healthy dietary habits with minimum saturated fats. I can say you can make it zero, that is better than anything. And the last but not least is meditation to minimize your stress. We are very used to lots of stress in our day-to-day work, our day-to-day habits, duties, and everywhere in office, at home, everywhere. Such type of patient people are very prone to have stress, mainly in Delhi type of metro city. So, how to minimize our stress? Your habits of meditation and yoga can minimize this. So, take help of meditation, take help of yoga to minimize your stress. And yoga also helps in optimizing your cardiovascular system, your pulmonary lung breathing system. So, it is very helpful to minimize your stress and make your heart and lung healthy as well. So take up help of meditation, yoga, good dietary habits, aerobic exercises, and just say no to smoking, alcohol, and out home parties. All of these can make you having a very healthy heart. And last but not least, beside this, don't think that you are not having cardiac disease if you are non-smoker, non-alcoholic, having meditation habits, yoga habits, good dietary habits. Beside that, you can have cardiac disease. So you must be aware about the sign and symptoms of the heart disease. That you can feel chest pain on exertion, even at rest after having meals. You can have shortness of breathing on exertion, on walking, and you can have nausea, vomiting. You can have acid peptic disease type of symptoms. Heartburn is very frequent in cardiac diseases, and you can have palpitations, weakness, all sort of cardiac symptoms. You must be aware of that. So, despite having good dietary habit, good aerobic exercises, and modified lifestyle, you must be aware about the cardiac disease signs and symptoms. And if you having any one of these, you should visit to your cardiologist, your cardiac surgeons, your CTVS surgeons, your any physicians who are able to diagnose all these things and get tested and get treated timely. So it is equally important. Preventive measures, and secondly diagnostic measures on behalf of your signs and symptoms, and treatment as early as possible. So my message to all of you that firstly you try to prevent your heart from any sort of disease by preventive measures, that modified lifestyles, aerobic exercises, and quitting the bad habits which are insulting your cardiovascular system. Besides this, you must be aware about the signs and symptoms of cardiac and vascular problems. And if you are having on any one of them, you should suppose to visit your nearby cardiac specialties and get tested, diagnosed, and treated by them as soon as possible. So prevention and treatment both are equally important, because besides preventive measures, we are predisposed to cardiovascular disease on behalf of our genetic predisposition and a lot of things, dyslipidemia, familial dyslipidemia, which are non-stoppable, and they do predispose you to cardiovascular diseases. So just make yourself safe from the cardiac disease, and if you supposed to have any one of them, let you visit your nearest cardiac specialties and get treated timely. Only after that we can minimize the cardiac disease morbidity and mortality, sudden cardiac arrest and heart attacks and valvular heart diseases, all sorts of things. There are so many spectrums of diseases. so we can prevent them. And if we have, we supposed to go and visit the cardiac specialties, get diagnosed, treated, and make ourselves fit and fine. Thank you so much.